Rolling.
Renegades.
Andre and I had this big idea.
Growing.
I had to have the people who didn't believe in me.
Between one day and the next, everything changed.
Nurses know how to solve shit.
Renegades.
Welcome to the RNEgade podcast, a revolutionary approach to continuing education for nurses who don't just do what they're told. We're shining a light on the innovators, the creatives, the renegades, who are blowing up the boxes that the rest of the world is still trying to think outside of. Our guest today is Stephanee Beggs, an ER nurse who has taken continuing nursing education not just to a whole new level, but with her educational platform, RNExplained, she's moved it over to a whole new planet where common sense and practical application is an art form. In this podcast, Stephanie shares her unconventional journey into nursing and her efforts to support nursing students and new grad nurses to bridge the gap between the textbook and the patient bedside. Stephanie shares her experiences as a nurse working in the emergency room and as a nursepreneur building a career that reflects her passion as the founder of RNExplained. Stephanie emphasizes the importance of understanding core nursing concepts and advocates for curriculum reform to better prepare students. Her proactive approach and innovative teaching methods inspire new nurses to feel confident, competent, and engaged in whatever role they play in their vocation as a nurse. Please enjoy learning from Stephanee Beggs.
How are you?
I'm good. How are you?
I'm very good. The goal of this is to introduce you to our RNEgade community and hopefully many other RNs from other communities, from other podcasters around, so that people can get a flavor of you. If they haven't heard from you before, because I know that your audience is a lot of like new nurses and nursing grads and stuff like that. Mm-hmm. So I'd love to because I don't know that much about you other than stalking you on the internet. Can you just give us just an informal introduction? Where'd you grow up? When did you decide to be a nurse? Why did you basically, how did you get here with me today? What led you to getting here finally with me here today?
Yeah. So my name is Stephanee. I grew up in Southern California, the Valley, Santa Clarita, if you know where that is.
Yeah.
Yep. Santa Clarita, born and raised out there. I actually have a very untraditional route to where I got to where I am today. I actually went to college in San Francisco and I majored in business marketing. So I did not always know that I was going to be in the healthcare field. I thought my whole family is in business, so I thought I was going to go the business route. Did not know, fast forward to now, did not know that would actually come true. But I went to San Francisco, got my degree in business marketing, hopped around at a couple different colleges because I didn't really love the one that I was at, and got that degree. I worked at Warner Brothers for a little bit, which was not my vibe at all. And then I decided to go back to school and do something in healthcare, which is something I've always really been interested in. I just never took the jump to do it. So I went back to school. I did my prerequisites at a community college here in the Valley. And then I went to nursing school, graduated nursing school, and then started this business during COVID. So
just tell me a little bit about what it was like growing up. Do you have siblings growing up in Southern California? What did people used to tell you should be this when you grow up?
So yes, I have a brother and a sister. They're both older. I'm the baby of the family, and everybody in my family is in some sort of businessy, computer techie kind of world. And so all I really knew growing up was you should do something in that. You should do something in business, stuff like that. It was never really anything in medicine at all. I actually when I decided to pursue nursing, I had nobody to really kind of help guide me in the healthcare field or going to nursing school, because everybody that I knew was more so business, entrepreneurship, and things like that. So yeah, people pushed me to do something business related, not really anything healthcare related. So
when was it that you decided, what made you decide nursing?
So I didn't decide that I wanted to actually pursue nursing until I had graduated with that business marketing degree, and then worked at Warner Brothers. And then I realized this really wasn't like what I wanted to do. Then I took a step back, and then I realized, what is it that I actually like enjoy? Growing up, I had always loved anything human anatomy. I was in honors human anatomy in high school. I love gory things. I was always the one in my friend group that like took care of everybody else, like at the high school parties, and nothing grossed me out literally at all. So I was that person growing up. Never really thought anything of it. But then when it came time to kind of reevaluate what I wanted to do with my career and make that switch, I was like, healthcare has interested me. The gory aspect of human anatomy interests me. So what can I do with that? Then I looked at a couple different, I actually really wanted to be an anesthesiologist. When I like wanted to make the career change, but then I thought, that's going to take me freaking forever to do. So I was like, what else interests me? And then I chose nursing.
Did you know what specialty you wanted to go into right away, or were you like going to try a couple different ones on?
No, I had no specifics. The only thing that I was kind of basing that off of was when I decided to make that change and apply to nursing schools, you need a ton of volunteer experience or work experience or something like to put on your resume. I had nothing. I had no experience in healthcare at all. So I ended up getting one of my first jobs was a medical scribe at an ER-based urgent care. So I was surrounded by all ER physicians. And that I think is kind of what sparked emergency medicine for me. That's all I've done. Fast forward now to being a nurse. That's all I've done was be an ER nurse. So that I think sparked my interest. I also, because nothing grosses me out and I love like really gory things and like traumatic things, ER kind of like spoke to me in that way. If I didn't do ER though, I really found a fascination with cardiothoracic. Like I was on a cardiothoracic unit when I was a nursing student, and I loved anything that had to do with the heart. I loved that. So I would consider like doing that, but ER has my heart 100%. So
okay, so you went into the ER, you became a nurse, and what was it that made you go, okay, this is crazy, I have to do something about it? Because a lot of nurses, like, no matter what your specialty is, there's a lot of things that could be fixed in the nursing profession and in healthcare in general. And there's rare individuals that don't just sit there and complain about it. They're like, right, I'm going to do something about this. And you are like the epitome of that. What was it that made you pursue RNExplained? Yeah, I was trying to think of that. What made you start that? What did you see?
So RNExplained, in a nutshell, RNExplained is an educational platform. I sell educational resources for nursing students, but I also teach them on many different social media platforms. And on top of not just selling products, RNExplained is also kind of just me in my everyday life. And you do see the ER side of me, and you see like what I struggle with and what I've been learning and, things that I went through as a new grad and things like that. And so I think when I became a new grad, it hit me that nursing student life is so different than new grad life or nurse life, right? Like taking what you learned in a textbook and putting it into bedside knowledge is so incredibly hard. And at the time, no one really even talked about that, like transition. And so I did. So I documented on social media my whole experience, my thoughts, what I learned, what mistakes I made, and things like that. And that also translated into all of the resources that I was selling through RNExplained too, because I got to add in all of my experience as a new grad and a nurse now to this day. So I think that when I was a new grad, that was kind of the aha for me at that time, was like, no one really talks about this, and no one really kind of gives like the real life nursing aspect. What am I learning in nursing school that actually is going to be translated over into bedside experience or life? So I wanted to be that person for all the new grads out there and for all the nursing students out there, to kind of give them a little glimpse into like, this is what you're learning in nursing school, and it actually will come full circle one day. You just got to wait for it. But this is my experience with it. So
Yeah, it's funny. I just did a podcast with Sarah Lorenzini, and
Yep.
we were talking about, like, I went to University of Michigan, graduated in 1996. Still it was, one of the best nursing schools in the country. And all I ever wanted to do was ER nursing or ICU nursing. I wanted the high adrenaline things.
Yep.
I became a nurse because my mom told me to, so I was going to make it fun. And I remember the day before my job started, my orientation, and going out to dinner with these two Canadian nurses who had gotten there like 3 months before me. And I didn't understand a word they were saying. It was like they were speaking another language.
Yeah.
And it
truly.
was so scary. Like, I knew I wanted to do this, but how am I possibly going to ever? And I was like, did you guys learn this in nursing school? Because I didn't learn any of this in nursing school. They're like, no, 3 months. And I learned what I needed to learn to be an ICU nurse in those three. And of course, you're always learning more in developing your skills, but nothing that I got in nursing school prepared me. And it just makes me wonder, why weren't those 3 months put into the education that I paid for so that I could hit the ground running? And you are kind of a bridge to that. It's like the nursing schools aren't keep catching up. It takes a long time and a lot of power and fuel to turn that ship around, because it's been going in the same direction for 100 years.
Yep.
What made you think, I'm going to do something about this, when there wasn't anybody else doing it?
I don't think there was really like a pivotal moment that made me think that. I think it was the accumulation of that feeling of wow, why didn't I learn any of this in nursing school? And also becoming an educator. I did teach at a university here in LA. I taught pharmacology. And when I taught that, I realized that you're so right. The nursing curriculum there's so much change that needs to happen with nursing school curriculums and how deeply rooted and like ancient they are. And I saw the difference between the way that I teach and the way that nursing school curriculums are handled, right now, or like how they're structured, and like the massive difference in that. And so I always tell myself like that needs to change. I'm one person. So like slowly I'm trying to like change that kind of curriculum for universities. But there was no like pivotal moment. I think it was just the accumulation of my thoughts, my experiences as a new grad, but also with students, being the educator on the other side too, and seeing like the struggle that they're having. And it's just like, why can't we change this? Why aren't we doing anything about this? So yeah, slowly but surely, I'm trying to fix that curriculum ancientness of it.
What of your education and your knowledge, and actually growing up and absorbing, like, through experiential osmosis of, your family who are entrepreneurial and in business and stuff like that, what is it about that kind of inherent knowledge and understanding and way you saw the world did you bring into the way that, are there any over, like, a Venn diagram? Is it like any parts of the knowledge and skills you gained from your experience growing up with entrepreneurs and the business education you got influence the way that you bring RNExplained to the world? That's what I was trying to say.
I would say, if there's one thing that comes to mind, it's that I feel like everybody is a student their whole life, kind of. We're all learning forever. And part of being an entrepreneur or an educator is having that patience to teach people. But I don't know, it's kind of hard. It's kind of hard to explain. I just feel like everybody, no matter what career you are in, is new to something. You always have something new to learn. And so for RNExplained, I try to keep the mindset that everybody could learn something from me. Nobody knows it all, especially in healthcare. No one knows it all. I don't know. I learn something new every single day. And keeping that mindset of not making people feel dumb or stupid, like the cliche thing, no question is a dumb question, and allowing people to ask the questions and being patient with them and stuff. Kind of what I've learned growing up from my own family of entrepreneurs and them owning their own businesses and having to teach things to people all the time. I see that. And so that reflects into how I teach others. Also, like the leadership aspect too. My whole family, obviously, because they are entrepreneurs or in the business world, being a leader in some sort of way has to you have to have those qualities. So I've always kind of had like leadership qualities that have carried over into running a business and being an educator. Yeah, I'd say those.
What position do you have? Are you like just a staff ER nurse, or what's your position at your current job?
Per diem. I'm a per diem princess.
Yeah, we've all been there.
Yeah, but I've done it all. So I was staff, obviously, as a new grad. I did travel per diem. So I've only done local. I haven't traveled outside of California. I've only done local, which a lot of people actually don't know is a thing. If you are within 50 miles of the hospital that you are traveling to, that is considered local. So I'm not like, I don't have very exciting places.
No, I've done the same thing. It's an entrepreneurial twist, though. Actually, it's like,
Totally.
okay, actually, I've seen some of your Instagram things, and like I love the one with the different colored P and what it means. Yes. And how you used all that. It's such a great and such a unique way of teaching and explaining things. It's not like death by PowerPoint with a tiny little head in the corner.
Yeah,
it's
not my style.
Yeah, no, it's very experiential, and it kind of covers visual learners, kinesthetic learners, people who you found a way for the people who learn by doing to be able to get that same experience, even from like a digital delivery system.
And I think that's how I grew up. Like that was my way. Growing up, my learning style was always like a visual learner. I was not the type that could just listen to somebody talk for hours and be like, aha, I get it. Like I had to see things and watch things. And so that's kind of how I teach now. And I found that when I started RNExplained, there were so many people around the world that learn the same way that I do. That's kind of why I ran with the education style that I have. So I try to tap into audio, visual, kinesthetic. When I got my master's degree, we had to do an entire presentation on the different types of learners. So I did a whole presentation on that and learned so much about different ways to like educate people, which luckily, ironically, I was already doing like a part of my company. But it was nice to see that like solidified when I actually did the research.
How do you decide what you're going to do an educational bit? Like, is it like what happens at work?
Sometimes if there really is no rhyme or reason. I feel like a lot of people try to come up, like when they're starting a business, they try to come up with like a structured like plan. I've never had a structured plan to like what I'm doing, what I'm posting, nothing. It's really what just inspires me like that day. So sometimes it is something that I learned in the hospital or a mistake I made that everybody else would probably benefit from. And I'll talk about that. Other times I think of a topic and I'm like, wow, I can explain this really well. So then I, type it out, I talk it out to the wall, and then like I'll film that, and those do really well. And then sometimes I sometimes base it off of people in my DMs. If they all have a collective thing that they're struggling with, I will talk about that one day, but there really is no like structure. It's basically just whatever I'm inspired by, or if I see something sometimes in like a video, that will spark my interest in talking about a certain topic. Yeah.
Yeah, you're following the breadcrumbs laid before you and the effervescence, because even if something looks really good, it comes across in what you post. That not only is it going to be helpful, but you're really interested in it. Like you seem very excited about what you're teaching.
Oh yeah, I go down rabbit holes. And it's so funny because I think everyone, when they watch my videos, they think it's very like a quick little educational thing that I just like set up the camera and start talking. But I go down hours of rabbit holes for every single video I make, not just because I need it to be factual and correct and evidence-based and stuff like that. Yes, that's like one aspect of it. But I also am just so fascinated sometimes with like the topics that I'm talking about. Like the other day, I just made a drawing on a nephron, like for the kidneys, because I wanted to talk about different diuretics and what part of the nephron do.
Oh my gosh, excellent.
Yeah, and that stuff fascinates me. So I drew this whole picture and then I sat there and I was like, well, like I understand this, but like why do potassium sparing diuretics work on this specific part of the loop of Henle? Like what ions are going out? And then I went on this whole tangent of like research, and I spent hours researching like what ions are like leaving and entering the nephron, and that's why like you see those diuretics working on that part of the nephron. And that happens to me every single time I do something. So I really find it like actually genuinely fascinating. But also there's the other aspect of like I want it to be factually correct too and evidence-based, and if somebody has a question, I want to know how I can answer that right away and like know the answer to it. So yeah.
What are the things that you most get asked by your followers, your listeners, your viewers? What are the things that are most helpful to them? What fills in the gap that you and I experienced as new grad nurses and were like woefully unprepared, that they give you feedback and say, this was so helpful? Like what are the things that you wish you had had mostly?
I think it's the visual aspect of how I teach. I think that a lot, especially me when I was a student, and also when I taught and I saw the other professors, and then what I hear in the DMs is that students will go to class and then they get fed the PowerPoint, and that's basically it. That's their only way of like getting the information, and then they're just expected to absorb it and like fully understand it. And so the gap that I fill is not everybody learns like that. Most people actually don't, which is very interesting that like that is the approach that nursing schools take or professors take. But so I fill the gap of teaching the same thing you're learning in nursing school, but in a completely different way for the audio, for the visual, for the kinesthetic learners. And that's the gap that I wish somebody filled when I was a student. Yeah. Yeah.
What is the thing that they most request to know more about?
Ooh, it could be any topic. Like if it was education wise, usually they'll semi-understand the topic, like, I don't know, digoxin, for example. Like they'll understand what it does, but they cannot put it into like a scenario or like a NCLEX question, and like they'll understand the facts of digoxin, and that's like what they were fed in nursing school. But in order to put that into practice future, when you become a bedside nurse, you have to understand like what actually is happening in the body,
the mechanism of action, and
that stuff, which is like, you can learn the facts all day, but to understand like what is actually happening in the body and why digoxin and why we're looking at certain things as a nurse and like the parameters and things like that. I don't even remember what tangent I was just going on there.
No. What do people most? It's the knowing over the memorizing. So from you, the requesting and receiving the learning rather than the memorizing. That's so magical. I remember when the penny dropped for me in my pharmacology course way back, 100 years ago, when because all my my peers, would get together at Denny's and study all night for courses. The penny dropped for me when I went after learning what each receptor did.
Exactly. It's things like that. Going to the core. And then all you have to do to know what a medication does, what its side effects are, and everything like that. If you know what the receptors do and what the drug is, an agonist or an antagonist of that receptor, you know what the drug does without even having to look it up. Then you know all the side effects, then you know the nursing considerations, like everything. It's if you understand the core of the body, the receptors, the drug, like if you know the core, everything else follows. And it frustrates me so much that curriculums, but also in professors and instructors don't teach like that.
Yeah.
So I've always taught like that. And I mean, it showed when I taught pharmacology at the university here, and I was part of the faculty. It's so funny because there were 5 pharmacology professors. I was one of 5. We all taught, the whole cohort, they have a large cohort, and it was like 150 something students, and all of them were split amongst all 5 of us. We were all teaching the same thing. It was all the same, on the syllabus. I taught mine so different than how the other 4 instructors taught their class. And I had students from their classes trying to get into mine because they were so lost. They had no idea what they were learning. Nothing clicked, nothing made sense. And then they had their peers that were in my class that were like, oh, let me show you, like Professor Beggs like taught it this way to me, And so it's just so funny, like to see how education is definitely changing, and like nursing schools need to kind of change with the times. But yeah. So I remember that, and all the students that wanted to be in my class, or they come to my review sessions instead of their own professors. Yeah.
Yeah. And I love how you're like, you're not in academia at the moment, but you're creating your own academy with by the way you teach.
Yep.
And it's almost like if nursing schools would take out some of the chaff and some of the fluff that just isn't relevant anymore. And it's not that I used to say like, oh, care plans are so stupid. That way of thinking is still important, but there's so much time spent on it that could be applied to, I think if nursing students were taught the fundamentals, the mechanics, like you're talking about, like, going down to the way upstream, the basics, the receptors, the cell wall, the proteins, and how the proteins are formed and whatever, and how this chemical, when it fits in the lock and key, will create this action. And then like spend the time on that.
Yeah.
And then when they get to a clinical, their first clinical job or whatever, they'll have that ability to go back and think about the mechanics of things, not just pharmacology, but, all
the whole body,
all the pathophysiology things, and knowing the mechanism of a disease, what actually is being altered in the body farther and farther away from homeostasis.
Yep.
And how do we facilitate the body getting back to homeostasis when it's like lost in a cell danger response rabbit hole?
Yeah, I always say, like, the way that I teach and like what I usually emphasize is like when you're studying anything, you understand the what and the why, like what is happening in the body normally. And then when you get this disease, what changes? So what is now happening? And then why do we see that change? Like when you understand the what, the why of why we see certain signs and symptoms, why we're doing certain things as nurses, why we're watching certain parameters of things will all follow if you understand the what, like what is normally happening at the core of the body. That's how I approach anything that I'm teaching, is understanding the what and then the why.
How do you see the Stephanie Beggs Empire expanding? What are you going to do next?
Want to do so many things. Well, there's a couple different avenues. I want to obviously expand and get more exposure. A lot of nursing students don't know who I am, but some of their friends do. So I'm hoping to kind of expand and grow and get more exposure to more students. I did do a tour with Blake, Nurse Blake, probably know.
Yeah.
Did a tour with him around, I think it was like 5 or 6 different nursing schools in the South. And we taught things like Blake taught interview, tips and prep. I did a pharmacology review and a bunch of different things and stuff like that. And I want to do something like that, just on a bigger scale, and physically go to nursing schools. Oh, I did like an NCLEX review, things that I can help out with where that's lacking in like certain schools or whatever the students need. So we called it Beyond the Books. It was like literally exactly what it's called, beyond the textbook, what you are learning, from me or from Blake or whatever. And that was so much fun. So I want to do something bigger on that scale. obviously create more products. Right now I have like my comprehensive bundle, which is like my baby, and that is created and perfect, and I update it every year. But I want to do like more pharmacology, or not pharmacology, more flashcard sets and like things that you can take on the go and stuff like that. So
Oh my
that's
gosh, it's so fantastic. I'm gonna stick a pin in that and then go backward a little bit. So when you started doing this at work, like it's like it's too late for me. Like nobody like me was here to help me when I first started out. So I'm gonna be that person for nurses to come. What did that change about how you approached nursing in general? Did it make you more engaged in what you were doing because you're always trying to think of
yeah.
things to teach? Did it make you a better nurse?
Oh, it for sure made me a better nurse. I think if anything, the way that I kept up with my education and my knowledge helped me so much as a new grad. I hopped into the new grad position, and yes, it was very hard, don't get me wrong, but I did have a lot of knowledge that I was consistently refreshed on. That
Mm-hmm.
helped me a lot. In terms of nursing, yes, I think it helps me a lot to connect the dots a lot quicker on things that I'm doing, or like questions that I have for, the doctor of certain orders that I'm receiving and things like that because of what I know. And also in terms of educating patients too.
Oh
I
yeah.
think that's like a huge thing that's like missing or absent in like, sometimes if we're too busy, we hand the papers to the patient and send them on their way, with like minimal education. Or if they ask a question when I'm like administering a medication, I like to spend that time and actually educate, kind of like what I do like to nursing students or on social media. I do that with my patients too. So I'll like educate them on why I'm giving what I'm giving, or what's supposed to happen, or what they can expect to happen, or discharge paperwork and things like that.
That's great. It's like your clinical position becomes like an educational
Sure.
laboratory.
For sure. And I just love teaching, like anybody who will listen. So yeah.
What do you love? You've mentioned pharmacology a lot. What other topics do you love to get down rabbit holes with?
Pharmacology is a huge one. I love anything cardiac. So like myocardial infarctions, like angina, like things like that. And more into detail when I talk about those things. I love to bring in real world experience. I also think that's a huge like educational tactic, is to bring in real world experience from a heart attack that I received and the symptoms they had, and like kind of make that all come full circle for students.
Mm-hmm.
So things like that I love to talk about. Pediatrics sometimes I like talking about, even though it's like very hard. It's like 18 years of life to talk about, but it's interesting. And
What do you like about pediatrics?
I love the critical, of course, like the critical conditions,
Yeah.
like for pediatrics, like meningitis and like things like that. I also love teaching that's like very non-textbook, but like IV insertion stuff for pediatrics. I love starting IVs on peds, which is so weird, but it's like a game.
No,
Like, oh, I love it.
no,
So,
not once, there's two kinds of people in the world. It's like people who like to put IVs in premature infants
yeah.
in high turbulence in a plane.
Yeah.
Yeah, and the people who just like I never want to put an IV in somebody else ever again because I always miss. Like, what's the difference between those two?
But what's the difference
Them,
between,
yeah, I'm sure not every nurse is in the right position, not in the right seat. And I think that we get a lot of advice, career advice. It's like the conventional status quo career advice. You have to start in med surg first and, cut your teeth and
yeah.
then do this. But I think what that does is serve to put a lot of the wrong people in the wrong seats,
Yes. Yeah. And I think the beauty of nursing though is you can switch from specialty to specialty if you find that that's not what you like. So I always tell people you do not need to start in med surg. You literally don't. You start in whatever you want to start in and push for that. But say you do, and say you start in, I don't know, labor and delivery, for example, and you just realize that you don't like it. The beauty of it is that you can always switch. And the beauty also, I don't know if this is everywhere, but a lot of new grad residency programs, if you are not happy with where you are in your program, you can still you can switch units. You don't have to like continue it out for that full residency and like suffer. You can actually switch. So I think that's amazing that they're doing that. And yeah, I think it's a lot of trial and error too. Some people go through clinicals and they never had something that they liked, and then they, just end up on a unit that they actually love. And then there's the other side that really want to pursue something, and then they get there and they're like, actually, this is not what I like. But it's a lot of trial and error. And, but sorry, I'm like going on a huge tangent on this.
Please do. Please do.
I also like to tell people though, you have to give it a fair shot, because I do get a lot of people in my DMs that say, I've been on pediatrics, for example. I've been on pediatrics for a couple months now, and I'm a new grad, and I just don't know if I like it. I don't know if this is like for me. And I always tell people, like, at least give yourself 6 months at the least to really try it out and see if you like it. Because there were times I am live or breathe ER, I die for ER, but there were times when I was a new grad and I thought to myself after a shift, is this really like what I like? Like, is this like, do I like this? Do I want to be here? Am I cut out like for ER? And then it got so much better. I just had to push through, and it got so much better. And I absolutely love the fact that I stuck it out. And yeah. So
I think I love that you said that, because I think for 99% of nurses, like, nurses do not get into this vocation. I call it a vocation. It's not just an occupation, because it's like you're not, no one could ever pay nurses enough to do what they do, but that's not the reason they get into it in the first place. You don't get into the career to become rich or, get some kind of award, or it's because the juice comes from the people you work with and the patients you serve. And it sounds so cliche, but it's so true. I don't think there would be such a thing as burnout if we had the time to exercise the purpose and meaning that we were looking for when we became nurses. There's like lots of redundancies and there's a shortage and whatever. And it's not the shortage itself. It's not the redundancies in charting or, all of the red tape. It's not that itself. It's the time that it takes us away from the reason we got into the profession in the first place.
Yeah. And lose that. So
I love that you say that. And so following on that, it takes about 6 months to feel competent. And I think what makes nurses want to leave or think like they're not cut out for labor and delivery or ER or whatever is, I'm going to hurt somebody. It's like, and once you find the confidence to know that you're going to make mistakes, everybody's going to make mistakes, but you have the confidence to know what to do, and how to deliver the standard of care while being compassionate and nurturing and all of that stuff. Once you can do that, it takes about 6 months to be competent on any floor. Then you decide to stay. And if you go, you take with you the knowledge and the confidence that you gained in learning something completely new.
Yeah. And finding, I think in that 6 months, you're really trying to find like, who are you as a nurse, like, what does your nursing practice look like? And so that takes like a minute to figure out. And then in that 6 months, then you can evaluate. But I always say, like, you got to stick it out at least. What also is really big too, and I get this a lot too, is like your team members too, like the other nurses around you really play in a lot to your experience, like how you are shaped as a nurse too, is like all of the people around you. And I find that is a whole other like tangent of the support and the nurse bullies and things like that really play into a new grad's experience too. And we'll have them questioning, like, is this right for me? Solely because the people around them don't make them feel competent or heard or smart and things like that.
Yeah, it's funny because there's a couple different white papers on continuing education and nursing education in general that I've over highlighted and Douglas, like, why even print it out? And it's just like the whole thing is highlighted.
Yeah.
But the evidence shows that nurses learn and retain best from other nurses.
Yeah, totally.
And also nurses are the best destroyers of other nurses.
For sure, which is so
Yeah.
important. It's so important. That's like the saddest thing to me is like how other nurses can make somebody feel. And it's so easily like you can easily destroy a student or a new grad's confidence, like by what you say. So
You say that like you're standing back from it, like you're a witness of it, but not
I see it all the time.
a receiver of it. Have you had those situations?
Oh my gosh, all the time. When I was a new grad, I had my fair share of nurse bullies. I had even management, like even my management, and love a handful of my coworkers, but there were the few that like really had me questioning, like, wow, like, do you even want me here? Like, am I even fit for ER and stuff? So I've had my fair share of people making me feel like that, but I've also witnessed how nurses will make students feel, or other new grads that are on the unit with us feel. And so I make it a point, even if the new grad or the student is rotating through the ER and they're not assigned to me, I will always ask them, like, if they have questions, if they want, explanations on something, if they want to see something or do something, because like preceptorship, or when you're assigned somebody, like, yes, you're assigned to that one person, but that doesn't mean that like you can't go and hop around and see what other people are doing and like what else is out there. So I definitely make it a point to make sure if they're not having a good experience with whoever they're with, or I can kind of sense the vibes, I'll always jump in.
No, I love that. I think there should never be a one-to-one preceptorship. It's kind of like when the primary nurse, like when you admit to a unit or something like that, you're that primary nurse, but you're not with them. But they get to experience the nursing skill and the art of nursing. Like nursing is the medium, and we all are paint differently with the same medium, and to learn from different nurses, it should be like a team thing, which brings me to my next level of question.
Yeah.
So you saw when you were a new grad, this is a problem. Like I'm woefully unprepared and I'm going to do something about it for me. And you had that critical thinking ability and the ability you knew how to learn. You like that's a skill. Knowing how to learn is a skill. So then you expanded that and brought that to others in RNExplained. And now you're going more nebulous to nursing schools. So if you were king of the world or queen of the world or whatever you want to say, and imagine if, there was no holds barred and you could change the way that nursing education is delivered in the United States or maybe even globally, what are some of the things that you would change if it didn't take all of that change inertia to, turn the ship around? What are the things that you would do?
I would say the first thing that comes to mind, definitely the curriculum. So I think the structure of the curriculum and the way the order in which things are taught. So for the most part, like the order in which things are taught needs to be changed. And for instance, when I taught pharmacology and they were also taking advanced med surge, the things that they were learning in advanced med surge did not line up with the drugs that we were teaching in pharmacology. So when they were learning about heart attacks and nitroglycerin, and we should be teaching about nitroglycerin, aspirin, like things like that, right?
Yeah.
Never lined up. And so that was just like, what? That is so stupid that we are not structuring a curriculum in that way. It would make things so much more clear and like way more solidify what you're learning in all these aspects way better if that was the case. So that's the first thing I would change is the order
at the very least, the way it's done, you're missing an opportunity to reinforce.
Yes,
like
exactly.
Each reinforces each other.
Yeah. And that is another huge teaching tactic too, is like the repetition. I think from the research I did, you have to repeat something 10 times in order for it to actually stick in your brain. Mm-hmm. And so why are we not kind of doing that? Like, why don't we learn one thing in one class and then we repeat it again in pharmacology and learn that? And then, we repeat it again with like whatever homework that they have and then a review session, like things like that. Like, why are we not doing that? So I think that's the first thing I would change if there was anything I would change. I also would change the the things that we're learning too in terms of like content, and add in more like real life things, because I think a lot, like a handful of things that they're teaching in curriculums right now are so ancient that we haven't done that in years, like in bedside practice. And so a lot of things I feel like need to be cut out, and then new things need to be added. I would change immediately the fact that we don't get to practice IVs on real arms these days. Like they have to be on fake arms. That does nothing. Like
Yeah.
it's pointless. Clinical rotations, I think for the most part, clinical rotations are fine. You can only do so much with that. I just wish that we were allowed to, like, whoever we were paired with allowed us to do more instead of just kind of watching and observing. That really did nothing for me.
Oh yeah, the clinical rotations should be set up like a preceptorship. Like to me, if I had the first, like my ICU orientation, if that was like the last semester, I could have hit the ground running. Like,
yes.
Yeah.
Yes. And yeah, I think clinical rotations, for the most part, I had a great experience with them. However, in terms of doing things, like being side by side with the nurse and getting the opportunity to put in the IV or practice putting the IV or doing the shots or whatever, was so minimal. I really took nothing away like from clinical rotations other than just like observing pretty much, which is unfortunate. So, but I think that's not just like hospital or school problem. I think that's also like hospital problem too. So that I would change. Those I think are my big three.
How are you getting invited or asking to come to universities like what you did with Nurse Blake? How is that happening?
We reach right out. Sometimes universities will reach out to me, and that's usually for their student nursing association event that they hold. I'll definitely go to those. And then in terms of like me coming and saying, hey, I want to teach your class about NCLEX review, we reach straight out to the university themselves.
That's another example of just don't sit by the sidelines and wait for somebody else to fix it yourself.
Yeah, we try. Yeah. We reach out to the student. Usually we reach out to like the nursing associations and get the contact there, and then they give the contact of the program, and then we go from there.
You bring a lot of hope. You know, there's a lot of nurses, new and veteran nurses, sitting there going, oh my God, is anybody doing anything about this? And I'm so excited that you're going to be part of RNEgade to expose you to more and more, to build your influence, and that nurses can not only just learn from you because they want to be better nurses, but also get continuing education credit as a side effect from learning from you. And then eventually let's like start a college. You and Sarah Lorenzini should start your own nursing college. I think we should do an experiment and some research. I think we should have a pilot program, something like that.
Yeah, that'd be amazing. That'd be so cool. I would love that.
I know it's been so cool, like during this, however long we've been talking, 15 minutes or so, to see you light up, you know, like when you start talking about the geeky stuff and the rabbit holes and whatever, it's like, you know, so I'm an influencer and whatever. Like, oh my God, like pharmacology, and like, yes, you need to know, like, that kind of delivery is, well, that's why I started RNEgade. It's because I was listening to podcasts, and I was learning the information was being delivered through the Trojan horse of somebody's, either their personal story or their passion. They were like, you know, their childlike geekiness, pathological curiosity, you know, and the best nurses I've ever learned from were like, oh, you don't know? Come here, I'll show you, you know, and you're doing that. So what kinds of, for people who are new, kind of summarize where they can find you, what you do, like why the nurses that do know of you, what do they learn from you and how do they learn from you?
Yeah. So I have a couple different platforms. I have Instagram at Stephanie Beggs, and then TikTok at Steph Beggs. I have a YouTube, I do longer form kind of content. I will take hypothyroidism and explain it for like 5-6 minutes versus on TikTok and Instagram, it's about 1.5 minute little snippets of things you'll learn from me. Every topic that I talk about, I'll show you or I'll say where it's at in my comprehensive bundle. So if you own the product of mine, you can follow along. Or I also teach a lot of real life skills too. So if you are not the student and you are the new grad or the nurse, you can learn, real life things from me too that are not just textbook things. So I teach it all. I have those 3 platforms, and RNExplained.com is where you can find all my resources. And
It's very exciting. Thank you so much. Thank you so much for being for your time today. I'm very excited to have you.
Of course. Thank you.
We're just going to do the fake goodbye right now. So stay on. Okay. This is just a fake one. Thanks, everybody. Enjoy Stephanie Beggs.
Renegades.